We don't need technicians so much. We need healers. And how do you make somebody who's a healer? Well, you combined the knowledge and the teachings from medical school and residency and all that clinical stuff, and then you integrate it with the wisdom of the ages. And our profession needs that more than ever, and so does the rest of the world.
Yep. We are talking with my favorite guest today, Dr. Reed Miloy, and I wanted to welcome you back to the show.
Glad to be here.
This is part 2 of a series, so we just finished part 1, so if you haven't listened to it, you need to go back and watch part 1, and that'll catch you up to where we are. But for this part, I want to dig a little bit deeper into what you call the table of health and the legs.
Yeah, those legs are basically describing our lifestyle. The first one would be exercise. Second one is adequate sleep.
Okay.
8 hours of adequate sleep. Which for most of us.
I'm a pro.
Yeah, some people are world champion sleepers and some are not, and that's a huge problem. And then the third one would be emotional well-being, and then the fourth one is nutrition. And so these 4 legs all are related to each other. They're connected, of course, by the surface of the table. And so when you do something to one leg, it's going to influence the other legs.
I see. All right. So which is your favorite leg?
I can't choose favorites because you can't have optimum health and be a complete human without all 4 of those nice and strong. But I will say this. When I first came out of training, I was all about 3 legs, and I didn't have that construct of a table, that analogy, until I was having a conversation with a patient in the late 90s, and it just kind of came to me during that conversation that would be a good construct to work with. And the 4th leg was the emotional well-being component.
Yeah.
And that leg was painfully brought to my attention by a patient that I had. When I first came out of training, it was very unusual for doctors to be practicing what we now call lifestyle medicine or integrative medicine, but that just seemed like the logical choice or the logical strategy for the way that medicine should be practiced.
So we were taught, make a diagnosis, identify the disease, isolate the system pathway, write the prescription, give it to the patient, make sure they take it, follow them up, rinse and repeat.
And it works to a point. But it's a horrible, that is a disease-based model, if you will.
So when you talk about integrative medicine, how is that different?
Well, we're talking about reversing disease, preventing disease.
Right.
And so to do that, you have to take a look at the patient's lifestyle.
Yeah. And
so as a young, full of, shall we say, piss and vinegar doctor coming out of training, I was really high on exercise, the sleep, and nutrition. And one day we had a patient come into the clinic in a most dramatic fashion, and I had never heard or seen this person before. I first met Walt when he was coming down the hallway, and I could hear his breathing from basically the other side of the clinic. And so I looked around the corner, and here comes this just mass of a human being, and every single step was sheer agony for this individual.
Are we talking 600-pound type person?
Well, yeah. I mean, we found out later what Walt's weight was, but as he came down that hallway, Sue, he had blue lips, and I thought he was going to go we're going to code him at any second.
Wow.
And so when we got him into the exam room, the poor guy was just struggling to breathe. And I turned to his wife and I said, "Is this a good day or a bad day?" And she said, "Well, today's a little bit worse than the days before," and turned to Walt and basically said, "We need to put you in the hospital now." And
how old was this patient?
He was 36.
Oh, my goodness.
And he refused that. And so, here I'd been this guy high on all this lifestyle stuff, and I've got a guy who's really acutely ill. And I was just thinking to myself as he was coming down the hallway, broccoli's not going to help this cat. And so,
The sprouts, they just don't seem to.
when we did an EKG on him, and it was a bad looking EKG, and he completely refused to be admitted to the hospital. I sat down for 2 hours with he and his wife and
Wow.
talked to them about broccoli and a lifestyle of eating a whole food plant-based diet. And she took copious notes. And when they left, I thought there's no way in the world that I'll see him again, because we'd scheduled an appointment for the next week. Our scale could not weigh him. And so our office manager had found a furniture outlet nearby, and they agreed to weigh Walt, and he went by, and it was about 650 pounds. And so, it was really one of those situations where you thought, there's just no way he'll get through the week. I gave his wife my cell phone. I got a frantic phone call that night.
Wait, you gave out your cell phone to a patient?
We just got there's new things called cell phones.
Wow.
And so she calls me just frantic because Walt had collapsed the couch and was stuck in the couch.
Oh my goodness.
And because of his mass, he just couldn't breathe. He was having restrictive
gosh.
hypoxia.
What'd they do?
So we called the fire department and explained to the fire department the predicament, and talk about going beyond the call of duty. These guys showed up, and not only did they get Walt out of the couch, but they brought their tools, their power tools, and they fixed and reinforced the couch on the spot.
Oh, my goodness. That's amazing.
Incredible acts of kindness and going way beyond what anybody would expect.
That's really sweet.
But the week went by, and he came in, and he was down 12 pounds. Now, that wasn't all adipose or fat tissue. That he started a lot of fluid. He was starting to diurese because he was eating healthier. And we basically would have appointments every 2 weeks. And every time he came in, the weight was down further. And then we went to once a month. And at the end of a year, he was down, over 100 pounds. And then on and on it went. And he got about 200 pounds down from that 650 mark. And my ego became very attached to Walt. He was going to be my poster child, and it was going to be that, look, here's my trophy, and showing it to everybody that this is what a healthy lifestyle can do, and that lifestyle medicine is worth
investing
the effort.
in the effort.
It's the right way to go. But he came in after all this success. He came in one visit, and his weight was up about 8 pounds. And I said, Walt, what happened? He said, I got into some Cheetos. And
8 pounds of Cheetos. Cheetos are my weakness, right?
Yeah, Cheetos have taken out many.
Cheetos, I like to say.
Yeah, Frito-Lay, maybe we need to have a conversation with those guys. But he said, I'll get it corrected. So he comes back the next month, and now he's up 12 pounds more.
Oh, no.
And, I just knew something was up. And so I finally just looked at him and said, Walt, what's going on?
Yeah.
And he looked right through me, and he said something that I was just not prepared for. And he said, I feel more safe. And I wasn't, I didn't have the skill set at that time in my career to deal with what he was trying to tell me.
So he felt safe when he had more weight on him.
It was his armor. That was exactly how he described it. It was, and what he was saying is, I'm an incredibly sensitive human being, and this is my way of protecting myself, my shield from a cruel, mean world. So, I followed the textbook, the playbook the doctors are given, and made a psychiatry referral, and he died 6 months later.
Oh, my goodness.
And
tragic.
It was one of the greatest failures of my career. And he haunted me from the grave. I could hear his voice saying, young doctor, you know nothing about the source of suffering. And with what I like to call the Walt Effect, I grabbed a torch of curiosity and looked under that third leg of the table of health,
The emotional
emotional health, and went down into those catacombs and spent decades down there kind of plowing the sewers of the human mind to try and understand why is it?
Why do we act that way?
Yeah, why do we do this?
So this is where we both became life coaches, is we both
Correct.
had that we both came to that realization that the mind was at the base of the unhealthy habits that were causing the body to break down.
Yeah, I went through, I know everybody's coaching experience and training is a little bit different. I had just a superb mentor, Dr. Pamela Richard, who had been with the coaching movement from its inception in the late 80s.
Mm-hmm.
And in the training that we received, there were basically 9 principles they talk about at Coach U. And these 9 principles are just basically describing common principles that are found in all human beings. But I really struggled with those principles because I felt like something was missing and I couldn't quite put my finger on it.
Mm-hmm.
And I would have these at-length discussions with Pamela for like a year and a half. Pamela, something's missing and I don't know what it is. And then the story of Walt kind of percolated back into my consciousness again. And I realized what we were missing in medicine and coaching and everything is this thing I like to call stillness.
Yep.
And so it's the stillness component that is really it's more like an umbrella that overarches all of this.
All of the mental processes.
Everything.
And it's ancient. It goes through all kinds of spiritual belief systems. It's the be still and know that I am God.
Yeah.
Stillness theory.
Every one of our cultures has tried to bridge the gap between the realm of form, our bodies, our earth suits, and this other realm of non-form. And they all try in their way to get us there.
Yep.
And so helping a person go from this crazy world that we live in that's demanding our time, that pulls us in, that easily seduces us to getting lost in our role playing, and getting people to create some space around that and build this connection between their bodies and their earthly life, if you will,
Yeah.
and this other place of non-form. And there's been a lot of different analogies used. You could call it space. You can call it emptiness. I believe the Buddhist monks like to use the phrase sunyata, the emptiness that knows all. Some people like to refer it to God or just the infinite or whatever
Or the
it
universe
is.
or,
Yeah, just whatever. And so building that, a bridge, a conduit, if you will, a relationship between our form selves and this is what constitutes a complete human being. And that's why we have so much disease, so much pathology, so much crazy behavior from our leaders, because our culture worldwide, for the most part, there are some cultures that actually do encourage this more than others, but for Western society, there is a terrible disconnect between these two realms. And once that connection is made, then a person can never go back to behaving like
the same way.
The primitive, shall we say, monkey that they were acting out in their previous life.
Yeah. Well, and this is exactly what you take me through in your coaching. And so your coaching program is what, a 6-month, 4-month program?
Oh, it's whatever it needs to be to help that individual.
But the interesting thing to me about it has been that I've continued to practice and continued to grow, and it's continued to strengthen. And I'm teaching it as attunement because I'm a musician, and I think it's becoming
that word.
In sync with the vibrations and the energy around us, energy of the spiritual to the energy of the form. But I love how you have taught us today about the table of life and how you are encouraging the stillness theory. I think you and I are on that edge of educating and helping create a world where there is a better awareness and a better wellness in all of our lives.
Yeah, thank you for saying that. And, there's no profession that needs this more than the medical profession.
You mean ourselves personally?
Yeah,
yes.
Absolutely.
Because we've got a horrible suicide rate and just horrible health habits in general.
The very first day of medical school, the dean gets us all in the main auditorium, and we're sitting there, all bright-eyed, bushy-tailed, ready to go. And he walks up to the podium and he says, "Congratulations, you've now joined the most elite group of human beings on planet Earth. You are now part of a group of people that leads the world in depressions, suicide, divorce, and substance abuse."
Yep.
He literally closed this little notepad that he had and he walked off the stage. He didn't say anything else. And he really made his point clear to us. And we all looked at each other around the rooms like, well, should I get out of this gig now? And they've already got my tuition for this year. And I'm sure we all, to some degree, processed what he was saying differently. I know for myself, it was just, okay, you got my attention there, but I'm different, right? I'm going to be okay.
I'll beat it.
I'll beat it, right? That's what the ego says.
Yep.
But he was really trying to make a point, and we see that playing out throughout Western society for physicians. They are incredibly stressed, and what we need and the world needs, because we're all going to be a patient at one time or another, is we need healers. We don't need technicians so much. We need healers. And how do you make somebody who's a healer? Well, you combined the knowledge and the teachings from medical school and residency and all that clinical stuff, and then you integrate it with the wisdom of the ages. And our profession needs that more than ever, and so does the rest of the world.
Yep. Well, that's what we're doing here, one little podcast at a time. Thank you so much for coming and meeting with us and chatting with us today.
My pleasure.
Wonderful content.
Thank you.